Yeah, just a quick review of the Wellknee Herbal Knee Patch. So, what's it for? I mean, why would you consider using something like this? Well, this is mainly for people who have some kind of knee problem or suffering with knee pain. So for instance, if you have like, knee arthritis, or let's say, you hurt your knee, after like, doing a lot of gardening or, moving a lot of boxes, this might be something that you might want to consider. So what's in it? I mean, how does this thing work anyway? Well, anytime you're considering using something like this, you need to ask yourself one thing. What are the active ingredients? Okay, so what are exactly our active ingredients? Well, it's any ingredient that has a direct biological effect or pharmacological activity in the body. In other words, these are the ingredients in the product that really make it work. So in the case of Wellknee Herbal Knee Patch, you've got basically about four active ingredients. One is wormwood, and that works by having anti-inflammatory and analgesic properties. You also have radix acanthe, that inhibits the activity of sodium channels. It modulates inflammatory pathways. It also has ginger oil extract, which has anti-inflammatory properties. It also has borneol, which helps reduce pain signals. So there you go, four. That's not too bad. A lot of these things I look at, they have maybe one, maybe two active ingredients. This one has four, which is actually pretty impressive. So the question is, do you get permanent or temporary relief when you put this thing on? Well, it kind of depends. I think there are some situations where you actually could get long-term relief from using something like this. Basically, let's say you have a lot of muscular pain going on, because you can have pain from several different tissue sources, like the joint or the soft tissues. So let's say your muscles are aggravated or, they're sore and they're giving you pain. They can go into spasm and that creates pain and then that creates more spasm. So if you have like this pain cycle going on, then this is something I think that can help you, because what happens is, what you do is you put the patch on, it kind of gets the pain down, so that kind of interrupts this whole pain cycle. And maybe you wear them a couple times, it just interrupts that whole pain cycle, and so then you don't have to worry about it anymore. Unfortunately, a lot of knee problems like arthritis can become chronic or long-term, and in that case, you kind of need like a multi-prong approach. So you can use this to get the pain down, and that will enable you to do other things like, say, exercises. So for instance, let's use this as an example, Bulletproof Your Knee book. If you have any kind of a knee problem, make sure you're strengthening at least one exercise for your quadriceps muscle, okay? Maybe you can't do the exercises now, you put on the patch, pain levels go down or they're gone. Hey, now you can exercise and get your knee stronger and more flexible, so that way you do have long-term carryover. So that's generally the idea. So for instance, this is your quadriceps muscle, there's your kneecap for reference, and so probably just about any knee problem you can name. I can show you a study that has found that your quadriceps muscle, you have a problem with it in terms of being weak, or if they do like CT scans of the muscle, they find it smaller than normal. So for instance, like knee swelling in the quadriceps. Look at this. Another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, like swelling, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So you have any kind of acute, sudden onset or long-term swelling, it's going to affect your quadriceps muscle. And here again, in researching these studies, a lot of times they'll test all the muscles in the knee, and they'll find it's just the quadriceps muscle that's really the big problem. Knee injuries in the quadriceps, if you broke your tibia, your lower leg bone, you've had surgical opening of your knee joint, surgery before in your knee, they had to open it up, could have a problem with your quads. Ligament problems in the quadriceps. Here's an anterior cruciate ligament. You've heard that's almost like the ACL. You've heard of a lot of football players tearing their ACL. I mean, look at this. One study looked at people who had completely ruptured their ACL. Researchers found the strength of their quadriceps muscle in the injury was decreased like 25 to 30%. So the quadriceps muscle is the major stabilizer of your knee joint. So you have a problem like that, you're kind of taking the strength 25 to 30% right off the top of that muscle. And that's a big stabilizer, so you're decreasing your knee stability a whole lot. So it's going to be hard to get better or get pain-free if you have that much less stability in your knee joint. Posterior cruciate ligament, same thing, medial collateral ligament. Knee pain in the quadriceps. I find when people have pain in their knee, it affects the quadriceps strength. Here's a good one, knee arthritis in the quadriceps. So if you Google like knee arthritis and quadriceps strength, you're going to find tons of studies showing you that if you have knee arthritis, you have quad weakness. And so likewise, there are randomized controlled trials showing that, if you take a group of people with knee arthritis and you strengthen their quadriceps muscle, that their knee pain starts to go away. And some of these studies are even showing that the people in the studies with knee arthritis that have the strongest quads, they have the least progression of their knee arthritis. So you got lots of reasons you have knee arthritis, any kind at all, just to go ahead and strengthen your quadriceps muscle. Patellofemoral pain syndrome, I mean, this goes on and on and on. Other things you can do, fine-tune control over your knee. Here they're talking about like the hip muscles. So for instance, sometimes you have knee pain and there's nothing at all wrong with your knee. It actually is up at the hip. So in a case like that, classic example is iliotibial band syndrome. Have you heard of that? If you take a bunch of people with iliotibial band syndrome and you test all the muscles around their hip, they will find unusually weak hip abductors. Now the abductors keep your pelvis level every time you take a step. It also helps bring your leg out to the side. So here again, like with knee arthritis, you take a group of people with iliotibial band syndrome and you strengthen just their hip abductors, iliotibial band syndrome starts to go away. So isn't that interesting? Optimize knee flexibility. We all know your knee has to bend and straighten sufficiently. And like I said, maybe you can't do it now, but you put the pain patch on, pain goes down or it goes away. Hey, now you can start doing some stretches to make your knee more flexible, and that's going to give you that long-term pain relief. But hey, a lot of people don't know your knee doesn't just bend and straighten, it actually rotates. So about the last 10 or 15 degrees of extension, that's you straightening your leg out all the way, your knee actually rotates laterally or out to the side. And here's a little test to see if you have that knee motion. So that's a little accessory motion they call it that you have to have. Other things you can do, probably the last thing, increased dynamic knee stability. Here they're talking about proprioception. So proprioception is your position sense. So let's say if I suddenly turn the lights out now, you'd be able to tell me whether your knee is bent or straight. And that's because you have these receptors in the joint and the soft tissues around your knee, constantly giving your brain feedback as to where your knee is in space. So what researchers are doing, they're taking people with various knee problems and they're testing their proprioception and they're finding that it's decreased. So it's not like people don't know where their knee at, because that'd be like a true neurological problem. But they find it's just decreased. That's really not what it should be. So lots of things you can do, but hey, you might need to put the pain patch on to be able to do them. So yeah, definitely check it out.